Blood transfusions after surgery have significant impact on patients. They increase the risk of infection. They can even increase the risk of a cancer recurrence. Now, sometimes they're necessary, especially when a patient has a critically low blood level or when they have low blood pressure related to bleeding. But often transfusions are given when patients don't have either of those circumstances. In SCOAP, we're monitoring how often patients receive blood transfusions during elective surgery. We're also monitoring what their blood level was prior to receiving that blood transfusion. When you get your SCOAP report, if you notice that you've given more transfusions at your hospital compared to other hospitals, it's an opportunity to understand whether or not the transfusions that were given were absolutely necessary because the patient had a critically low level or because they were symptomatic, or simply because at your hospital some surgeons or other clinicians use blood transfusions more often than others. We're trying to avoid the use of transfusions when it's not critically necessary. When talking with surgeons about this point, it's important to recognize that not all surgeons have a commonly agreed upon point in which they transfuse. A patient's hematocrit of less than 21% has become a standard in some hospitals, and hospitals that have found a way to avoid transfusions almost all the time have a transfusion trigger. In this trigger, a patient only receives a transfusion when the blood level falls below this number of 21%. In this way, transfusions at higher numbers are avoided and patients have a lower risk of adverse events. When talking with surgeons, it's important for them to be part of making transfusion triggers happen. They also have to have the option to opt out of a transfusion trigger if a patient is ill. For administrators, this is also an important point because the use of transfusions increases the cost of care, and if there are adverse outcomes, it also decreases the efficiency of the hospital.